Hi everyone, I'm Prof Moosa, and this is a webinar by AYZA Health on psychedelics and mental health. It is a safe place, so feel free to rename yourself if you need. Go to the list of people, you click on that, hover over your name, and you'll see more pop up in blue. Use that to rename. Well, a very brief introduction to psychedelics. I think there are a range of psychedelics, some of them that have been there for thousands of years, used by traditional society, like psilocybin or magic mushrooms or ayahuasca. And then there's some of those that have been synthetic psychedelics that have been around since the 1950s, like LSD, MDMA. And then, of course, there's Keta-Therapy, which is what we're going to talk about a fair amount, because it's the one that's legal. The others are not. It is, of course, off-label use, so I'm going to refer to it as Keta-Therapy. It is, in fact, an anesthetic, very safe. I like it because it's really very much easier to control, shorter duration in terms of how it works, but I think that it's also IV, so one can switch it off and people can actually have results. There's lots of literature about the value of Keta-Therapy. I think, compared even to the other psychedelics, there's a pile of research that's accumulated in the last 20, 25 years compared to, in the other psychedelics. And I think that's part of the problem is the illegality of the others and the difficulty in doing research around this. And we can always talk about why it's so difficult to do research besides the legality of it. Well, the literature on Keta-Therapy, firstly, as an anesthetic, Keta-Therapy, what we use is available all over the world. It's encouraged to be used as an anesthetic. It is something that's very commonly used in poor countries because it's safe. Basically, it doesn't reduce your breathing very much. It has one major side effect, which is the actual dissociation. So nobody expects to break a bone, go on an anesthetic, and suddenly have these very dreamy, trippy stuff happening to them. So it's considered a side effect. But otherwise, the side effects are very nominal. While there's lots of benefits to it, and the literature around Keta-Therapy has shown that there are results of 80% response rates for patients with depression and suicide, anxiety, PTSD. In fact, the South African Society of Psychiatrists recommends Keta-Therapy as an option for treatment-resistant depression. There's a study that suggests that it is as good as the last resort in the psychiatric arsenal right now of electroconvulsive therapy, shock treatment, which has got lots of side effects. But Keta-Therapy was compared to that and found to have as valuable an effect without all the trouble that comes with being shocked. So it also is really useful in substance use, and we've got many patients who find great value in that, and also chronic pain. But let's talk to it just now. What are the values about this? And how it's helped patients themselves. So AYZA Health is a boutique service in Sandton, and we provide this Keta-Therapy. The idea is not for me to sit and lecture to you at length about this stuff. And I'll answer questions if there are questions from any of our viewers. Also, it is something that you can either put out a question in the chat or raise your hands if you feel comfortable to do so. But what I think will be most useful, and that's what we think you'll get more out of, is the fact that I'm going to interview a patient who's been quite willing to share their story. And I think you'll learn a lot about it from a perspective that will probably make a bigger difference to you than me telling you all the theory about it. So welcome. I would like to ask Nieke Lombard, who's been to AYZA Health, and she's very special, like all our patients, in that they're part of our family. I think we really care about their outcomes, and we do not want her to share anything that she's not comfortable. So Nieke, feel free to keep some things out of the picture and drop details. But I think really we appreciate deeply your willingness to come on board into this place and put it out, what you've been going through and how you found benefit. And I know lots of our patients feel very thrilled and wish more people knew about this. And it is very difficult to share this information. So, Nieke, welcome and thank you for being here.
Thanks so much, Prof Moosa.
Well, Nieke, just for those who are here, Nieke, would you mind sharing a little bit about yourself? Who's Nieke Lombard? Would you be able to share a little bit about that?
Nieke Lombard is a person who is trying to find her way, and that's fallible and has had a tough year and found Keta-Therapy. But essentially, occupation-wise, I'm currently a student. I'm back at studies again at the age of 35. I completed an honors in drama therapy last year, but I'm completing the journey to go into clinical psychology. So next year I'll do some third year subjects and continue the long journey. But before that, I'm really an actress as well as a teacher and a puppeteer. And yeah, I just had a long journey with mental health and discovering who I am and trying to always find the tools that will best serve me at the time, and also having to work through the stigma and with time come to acceptance that yes, I sometimes have mental health issues, and whatever tool is best, that will serve me. And that's where the Keta-Therapy really helped this year.
No, it's been very interesting also being your caregiver. I think I've found it really interesting our conversations. You being a psychologist in training, having also a sense of the dynamics that happen in our cells, in our psyche, and being able to engage with you on that has been really interesting for me. So I'm really pleased that you shared this very interesting person that is Mika. So, Nieke, would you mind sharing? You mentioned a little bit about it, but what were you struggling with? And can you perhaps tell us the story of your journey with mental health challenges?
Yeah. So I'd say about in 2014, it really started. I think for the longest time, I just buried all my feelings. I was a really over-functioning overachiever. And I think at a stage, my body stopped, said, this is enough of making like everything's fine. I think mental health, depression, anxiety runs in my family, but we don't talk about it. I come from quite a conservative family where it's you go forward in life. That's the kind of mentality. And eventually my body shut down and I started experiencing high anxiety, lack of motivation, loss of self-esteem, struggling to sleep, and eventually, my partner back then, the bubble of denial someone has to kind of just gently press through it. And at that time, my partner said, I think you need help. That stage, I started therapy, and eventually I went on to conventional, medication from a psychiatrist. In 2014, I started venlafaxine for my depression, as well as lots of other medication for the anxiety and the insomnia that kind of are always friends. It was a long journey. At a stage, I felt the medication assisted taking me out of a dark hole, but then the side effects and the cocooning, I felt like I was cocooned. I was out
Yeah,
of touch with myself, started to outweigh the benefits. And then I switched over to trying magic mushrooms and doing journeys on that. And that also assisted for a while, but eventually the depression came back. And this year, I'd say there was a few life circumstances, a few losses I had. I wanted to study overseas. That didn't happen because of lack of funding. I
yeah,
had a fallout with the department where I also was studying, which was a big knock, and there was something that was said about by the head of department that rocked me to my core. And then I went into acute distress response where my body was just in a feedback loop
yeah,
of fight or flight, really. It
yeah,
was
yeah.
really bad. And then the depression followed quite soon. And it's the first time this year in my life where the depression and suicidal thoughts went to a point of making plans. That has never happened to me until this year.
Okay.
And I also had a feeling there was something else going on because I went to a Kiso clinic and I got back onto venlafaxine. The psychiatrist put me back on medication, and I said, but I know there's something else with my body going on. Also, I felt the venlafaxine as an antidepressant wasn't working anymore. It's almost like I felt like I was getting worse. I even went to Tara Hospital as well.
Yeah, you
And
mentioned.
eventually I also got a diagnosis of Hashimoto's thyroiditis, which is an
Mm.
autoimmune condition, which is your thyroid gland, which also slows down everything else and can also
Yes.
exacerbate or create depressive and anxious symptoms. So it was a huge process of uncovering this year, but the suicidal ideation for the first time in my life at 35 was at a point where I was literally making plans. I
Yeah.
would literally look at the bulk, I don't know what that is in English, the wooden beam, and I would
Oh.
literally start measuring. And every morning, I know, I woke up and I would research obsessively. I would wake up with that heaviness on my chest.
Mm.
And the first thought would be, I want to die.
Yeah.
It's never been at that point until this year. And that's when I was like, there must be something else. I've
Yeah.
tried the prescription medications with the psychiatrists. I am still going to therapy, but there's got to be something else. And then I remembered my one friend always used to mention Keta-Therapy that worked for him.
Yeah. Yeah.
And it's funny, you can hear something once or twice, but when you're at a point of I was on my knees, and I was
Yeah.
like, there's gotta be something else. And I was like, I'm going to see if it works because
Yeah.
I was desperate enough. And I think the other options didn't work for me anymore. And I felt very resistant. And I was like, this isn't working.
Yeah. You mentioned a couple of things that I just thought worth sharing that this is not at all uncommon. I mean, the one that you mentioned was how other people who don't have this mental health challenge will dismiss it, shake it off, get on with it, And people with mental health challenges are actually struggling to deal with that. They can't just do that. It's like a rut and they're stuck in it. And what those of us who have better capacities think can we just refocus and just feel better by doing something differently can work. It just is not that easy. And I think it's not uncommon to find it in families, whether genetics or just the social context that's repeated over generations that just create this problem that is challenging. I think you also mentioned the difficulty with some of I mean, I believe strongly that as a medical doctor, as a family physician, that drugs as psychomedication is really useful. It has its limits. And I think that I'm finding many patients coming through, and that story you raise now just seems so very familiar, where they say, it helped me, but then it didn't. It kind of locked me up. You sort of use the word, bubble or insulate you, but many people talk about being straitjacketed. I feel like I can't feel bad, but I can't feel anything. I'm just stuck in a space which doesn't mean much. And it could be just as bad as feeling bad. You know, it feels no, not human. So I think that I quite find quite a common thread, especially patients struggling a lot. Well, I mean, you've been struggling with it, and then you've happened upon Keta-Therapy. I mean, Why did you feel that that's worth a bother? Why did you think, okay, let me do it? I mean, you've tinkered with psilocybin, but what made you say, let me give it a try?
I knew that the medication from the psychiatrist wasn't working anymore. You say I felt just as bad. It was like I
Yeah,
might as well have thrown medication against a rubber ball. It was bouncing back. And all the side effects that it comes with. And I was like, this is not viable for me anymore. And I've
yeah,
always had a bit of a push and pull being on psychiatric medication like that to that extent. And my friend really opened the door. Um, and I was desperate and I called him and I said, I'll keep him anonymous, but I'll call him John for now. It's a made up name. I said, John, like
no
I
problem.
am desperate. Tell me again about Keta-Therapy. Tell me about your experience. And I met with him for coffee again and just chatted again. And then I started my research because I'm that type of person. I'm like,
I
I want to
know
equip
you really
myself.
go looking carefully. You do your
Yes.
research.
And then I was like, okay, let's research. And I just came across a lot of testimonials actually from people that had gone through similar situation, depressed, highly anxious, really in a dark space in their life, with lots of suicidal ideation specifically, and then just hearing the testimonials of how they came out of it and what the Keta-Therapy gave to them. But the thing that really gave me hope is there was the sharing of many patients would speak about, and some of the research would report that the suicidal ideation would quite quickly after Keta-Therapy infusion, actually they would come completely out of it.
Yeah.
And many patients would share literally after the first infusion, they would feel a
Yeah.
lift.
Mm.
And at that stage, I was like, oh, wow, if that could happen for me or could eventually, I mean, that would be such a gift because I just don't know what are my options now? The pills aren't working. The therapy is a process, and the suicidal ideation, that heaviness is there every morning. And I'm desperate. So I was like, I'm gonna give myself a chance. Why not? This might actually work for me. There's that little voice that's always like, but
Mm.
maybe it won't. And I was like, I hear
Yeah,
you,
of
but I
course.
also hear the other voice of give yourself a chance. The research is talking about it. And then these
Mm.
testimonials and my very good guy friend, John. So I was like,
Yeah.
I'm
Yeah.
going because you fight for yourself. My psychologist said this as
Mm.
well. He's like, who did that research, Nieke? It's like, yes, I thought there was a part of me that still wanted to live and still thought I've got more to
Yes.
offer in life. Yeah.
Absolutely, absolutely. So you mentioned you're a psychologist. I mean, how was that? I mean, in itself as a journey, you've been very diligent as a psychologist in the making yourself. I'm sure you realized its value,
Yes.
but you've been with it for quite a while. And how did that journey go?
Yeah, so I started seeing Henry, my psychologist, last year when I started to have depressive symptoms come back. It was the academics that it was overwhelming, the high levels
Mm.
of stress. I could
Yeah.
feel the anxiety, insomnia come back, and with that, the dark thoughts and the depression again.
Mm. Mm.
And so I started working with him, more specifically outside of talk therapy, but more brain working recursive therapy, which really takes memories and reframes them again. And that had
Mm.
done me well, and I got back on medication again.
Yeah.
But when these losses happened this year, it reaches a point of I was in acute state. Even my psychologist said that you're in acute state, you need larger interventions. So first it was Akiso, and then it was Tara, which helped keep me safe,
Mm.
essentially, it kept me safe from harming myself for sure.
Yes.
But I remember starting the ketamine, and after the first infusion,
Yeah.
my suicidal ideation, I woke up without that suicidal ideation. And I
I
get
know.
emotional because that was huge for me, Prof.
Absolutely.
That was huge for someone that had been struggling, and like, you give it a chance, and then actually what I'd been reading in the testimonials actually happened for me.
Yeah.
And the Keta-Therapy together with my therapy worked beautifully hand in hand, because it was as if the Keta-Therapy opened a doorway that my therapist could now, those neural pathways were now open to
Yeah.
change and to more positive thoughts or different beliefs. So it's
That's right.
almost like it excelled my journey with therapy as
Yeah.
well, because my psychologist would comment a lot. He's like, we don't need to do this work today. It seems like after the Keta infusion, you have already moved through this.
Yeah.
I sometimes had a case of after an infusion where I would have to take things to therapy and we'd unpack it a bit further. But I felt like it just like made everything, my healing process went so quickly. And my psychologist had never been exposed to Keta-Therapy. And he was like, this is amazing. I'm going to start also telling my clients about it, because he wasn't aware of the new research or what was,
Yeah.
this is an option at all. And he's like a psychologist that's been in the industry for 20 years.
And I mean, I've had lots of patients come and say, like, get up and after these infusions, and this felt like 10 years of psychotherapy. And I mean, how does 40 minutes become 10 years of psychotherapy? It does amazing stuff in your brain. And a lot of it's very deeply, subconscious, unconscious, that things somehow fit together. I use that analogy. I'm not sure that I told you about a snow globe. Ketamine literally, ketamine therapy shakes your head out, again, everything goes up and settles back down. You don't actually figure it out, but it all goes back into a place that somehow feel resolved better. And 95% of it is just completely unconscious. You just feel like things are different and clearer and better, and you just figured things out. And it doesn't, you don't even know what happened. It just is there, and that's amazing. So I mean, you were before you sort of, when you were looking at Keta-Therapy, you were obviously looking at the evidence, the testimonials. What made you settle on AYZA Health? I mean, when you said, "No, I'm going there,"
Mm.
why did you decide to come to AYZA Health?
Once again, I researched.
Yeah, I know.
Make
Then
sure.
that'd be interesting to see what happened.
Yeah. So I was like, what are my options? And let me make the best
Oh,
choice. And so at that
yeah,
stage, I only found three different clinics.
yeah.
I looked at the one and I found they seemed very upmarket and the prices were a bit more expensive.
Okay.
And I was like, okay. And they had a therapy component, but I was like, I already received therapy. And I was like, maybe. And
Mm,
then John also mentioned the other one, but what I didn't like about it is that it's administered by nurses and you only see the psychiatrist now and then. So there's no control of your dosage. You don't have someone that's with you intentionally sitting there that's been on the journey with you from the beginning on the end. And I was like, that does not make me feel safe.
yeah,
And I
yeah.
remember when I made the phone call and your wife
I know.
answered, and I just automatically felt comfortable, her warmth. And I think it was also the fact that it's a family business.
Yeah,
And when I met you and your wife, I just felt safe and there was a personal touch to it, which
good.
I really appreciate because I don't do well with too superficial corporate or too cold. I want to feel like I'm going to be safe. And
Yeah,
yeah,
like your
and
family.
yes, yes. So the personal, the more intimate approach to it really resonated with me. And the fact that I knew you're going to walk a journey with me, that you are sitting with me in the room, so that if, I don't know, I go to a place that I'm very uncomfortable, you're there
Hmm.
as a reminder. Because I know with, these type of drugs, when you dissociate, you could be taken to places
Oh,
that are maybe uncomfortable, and you need someone just to
definitely.
remind you that you are essentially still here in this world and safe.
Yeah, yeah, exactly.
So that made me feel very right about my decision because I kind of knew what I needed and I could see you guys really cared. Because I also get frustrated with the medical profession. Sorry, Prof, I'm just going to speak in broad strokes here.
Let's be honest, be frank.
But where it becomes very clinical and you really just are a diagnosis or there's boxes just being ticked and things are just being ticked off. And
Yeah,
I felt I was seen as a person. Um, and that I appreciate because I've had bad experiences with other doctors in the profession where maybe the bedside manner, I don't want to just call it bedside manner, but just the way they treat you or um, sometimes coming with the arrogance, not really listening to you, you know.
yeah,
So finding someone that I felt I could speak to, that I'm really being listened to, that I'm being seen as a whole person, treated like a human being, it makes the world of difference because you're putting a lot of trust with someone for this, therapy
absolutely,
on this journey. You're
absolutely.
very vulnerable. So for me, I wanted to be in a very safe space where I felt good and solid.
Good. Well, when you say treat you as a person, I think I'm a family physician, and that's the mantra of being person-centered in the way in which we deal with a patient. In that biopsychosocial, but in ways that really don't think of you as just a bundle of disease and tick the boxes, like you say. And I think that, like you say, it's very special. We know that I very much appreciate that trust because I know, having gone through it myself, that it takes a lot of trust to go through this infusion. When you go through it, to get out of it and say, where the heck did I go? What just happened? It can feel very threatening, and it's important, at that time. And I go through a long story saying, listen, this is exactly what goes on at this point. I'm going to talk to you, and if you have any issues, speak. Just go through exactly what is going to happen, and know that I'm here. So when people are feeling a little untoward, and adjust it as well, because I think most of the literature is built on a very standardized dosing approach. Where I don't do that, I actually tailor it to individuals, the way they respond, which makes it very individualized and personalized, like you say. So I'm glad that it makes a difference. But let's talk about the experience. I mean, for you, I think a lot of people, I did tell people, listen, I can't tell you precisely what is going to happen in that space of a dissociation. So essentially, I tell people, like I said, listen, firstly, in the first 8 minutes, you will find yourself body shifting, where you'll find yourself feeling a bit swollen, a bit floaty. So that's okay, just go with it. And then at some point, and this is a sort of depersonalization, your person shifts. But at some point, reality shifts called derealization as part of this dissociation that can feel quite intimidating when suddenly you're like, oh God, where am I? I'm not even, the music suddenly feels like a visual and things shift and change. And it can be very distressing if you're not used to it or prepared for it. So I have to explain to you, and it's really hard to explain because I really cannot tell you. It's hard for you to tell me. Patients struggle and they come out, they say, wow, weird, wonderful. But hard to describe. They all share some of it, but it's really hard. So what was your experience like, and how would you help someone to understand what they're going to go through in that 40
Such a
minutes?
good question.
It's a hard one, actually.
It is. If, I just want to say that every infusion is different and it gives me exactly
Absolutely.
what I need to. Like the last one I did, just to share shortly, I grieved. I cried for 40 minutes,
Mhm.
as you know. And I must say, it's taken 2 days of integration, and I can really feel it settling in. And I had a little bit of like heavy thoughts again, but I've since the therapy, I've not had any suicidal ideation again, and my thoughts are generally, my outlook on life is very positive, but for a while it was a little bit heavier. And now, even after my last top up, I can feel the integration happening, and I can feel the shift again, and
Yeah.
like the openness and positivity come. And sometimes the integration takes time. And
Yeah.
I've
Yeah.
had some, sessions where the theme might be of love or gratitude or remembrance, but there's also sessions where it's working through a lot of pain, like abandonment, going back to like my core wounding of complete fear of abandonment. I often find the ketamine really goes for me. I don't know if it's because I'm visually orientated, but it often
No.
gives me like the distilled ex extreme image of the pain in an image and in a feeling that I'm almost
Yeah.
visualizing and experiencing internally. So it's like an internal and observation outside, but it
Yeah.
takes me to the core.
Yeah.
Um, yes, definitely feeling. I often put my hand on my stomach during the session, and I rub myself to remind myself that I'm still within my body. So I find little ways as well just to remind my body that while it's going through the dissociation as well as the derealization, where the world literally breaks down, it
Yeah.
all the constructs and who I am as a person and what I'm doing, literally I can feel it breaking all those constructs down. It's crazy. And then it
It
takes me
is.
often to these archetypal kind of feelings and experiences. It's so hard to describe, I'm sure,
I know.
but every experience is different. And often when I come out, I'm like, I have landed. The spaceship is busy landing because I feel like I
Very
do go
much.
to another world. And what I love about it as well is that I'm always conscious of what is happening. Compared
Yeah.
to times with using magic mushrooms, I would sometimes not be able to remember everything. And that made me feel very out of control. That's
Yeah.
another thing I really appreciate about the Keta-Therapy is that I am conscious of what is happening on the journey.
Yeah. Yeah.
So I feel like I can integrate better because I can essentially also remember where I've been.
Yeah.
And it gives me a sense of control because I'm kind of aware of what's happening. That
Yeah.
makes sense.
Yeah, absolutely. I mean, I think when people obviously are in a space where they need to be reminded, it just feels like, God, and it is that what's called ego dissolution, which is really the essence of the dissociative experience, is that your sense of self literally dissolves. And that dissolves literally is a physical almost, you feel like everything's disappearing, and where you are is constantly morphing. It is not an easy one to describe, But that sense of ego dissolution, that dissolving, tends to have a very strong psychological impact, where a lot of patients come out not only with the benefit, like you mentioned, of feeling better, thinking better, but coming out with very different sense of themselves, where they are, who they are, their relationships, their priorities in life. It just has things that a drug doesn't do, and psychotherapy doesn't necessarily say that's a priority. And suddenly that makes a shift, and people are able to then make decisions better. So it's really very sort of deep experience. And like I tell people, it is a lot of blood flow to the middle part of the brain, and essentially that middle part of the brain is where a lot of our subconscious, unconscious sits. And Keta-Therapy essentially creates lots of blood flow, but lots of connections. During the infusion, just everything's like in a tumble, like a laundromat. It's just all going around, and then you sort of settle afterwards. But it just goes so deeply, and it's like that strong shake to your sense of self, and you just have to deal with issues. And like you say, sometimes the next day is not exactly fun, because you've like a whole lot of stuff comes to you. You've got to make decisions about it. And I think some of the cautions I also make to people is, listen, do not think it's a trick, like a fix, like a panacea. You take it, go and carry on, and everything's suddenly cured. You will still have contextual problems, life choices that you have to now resolve. But somehow people make these decisions better, because they've just been forced into that corner that, you know what, you're not okay, and you need to make some of these decisions. So, like you've mentioned, the psychotherapy helps you to then get advances much quicker, and you've got to make decisions, and it's part of it. So, I mean, what difference did it make to you? You've kind of shared already a lot of that, how it made a difference. But I mean, what would you sort of look at and say, what were the material differences from before to after for you?
If I have to try and take stock, actually, I do not wake up. How can I put this? I value my life now, in the sense that I feel like I've got a life's purpose. My psychologist also said it to me. He said, you've become intrinsically motivated. So this
Yeah,
thing of looking outside now, I feel kind of solid enough to know kind of my worth and my journey.
yeah,
I don't have suicidal ideation anymore. What I do find, after the initial, it was 3 weeks with the two sessions, so it was six
yes.
sessions in total, and then the top ups. So even like recently, I could feel a little bit of a heaviness coming over me, and then I knew it's probably time for a top up. But it's not to the extent where with the suicidal ideations there, where I see life in a very negative way, and I feel like um, when I'm in that state, it's like there's no hope, which is
Mm,
not the case now. I don't have self-esteem, which is not the case now. I really feel like as I said, I value myself and I know my worth. Um, the feeling of being alone and like the world is out to get me, that feeling isn't there. Like
mm,
I'm the one that makes choices around my life. It's not to say life is life will come with its challenges. Like
of
even
course.
recently it would come with its challenges, and there was a lot of stress and I was very scared. Hence the ketamine once again in session gave me that place to say, cry because you're scared.
Mm.
Otherwise you
And you've
suppress
had
it.
some
Then
very challenging, things that have occurred to you. The Hashimoto's diagnosis being clear to you, and
yes.
that's a difficult one.
So understanding for me that depression is a place for me when I don't allow myself to feel, I don't deal with what's going on, and then my body shuts down. And then the
Mm,
infusion once again was like, Nieke, you've been feeling very scared. You've been going through a lot of losses. There's a lot of unknowns. It
yeah,
gave me the space to just cry and
yeah.
experience. And it took me again to that place of
Mm,
almost being like a child and just feeling very alone and scared. And it just allowed me to just process that. And 2 days after now, I feel lighter and I feel like I can move on, because that internal part of me that was like this has now finally gotten a space to just release. So it's such an incredible tool. So what I'm saying is I'm like 80% better. The beautiful thing is it still assists with, while I'm on my journey with the top ups, to really like you say, it's like it shakes what is really going on and like helps it to just come out. And that is healthy. That is healing. Because the depression for me is this, where you suppress, you compartmentalize, you deny.
Yeah, yeah,
It helps with whatever's processing that needs to be released. So
absolutely.
I'm so grateful for it because even as I'm speaking now, I feel alive, if that makes sense, compared to where I was, which is just completely shut down or in a complete anxious state.
Yeah, yeah. No,
Yeah.
definitely. I mean, I think that there's a lot of patients who find themselves really shaken in that sense, like you say, and have to make the some clear choices about what's going on in their life and say, listen, I do need to make a definitive move. I've used that analogy, you know, that it really is like a vigorous shake. Many a time I find patients who will sort of come with feeling bad after the therapy. They would do exactly what you just said now. They realize that they have thought about something sad, bad, problematic, but they only felt it after the ketamine. It almost accesses this emotional part of you and literally forces it to deal with the pain you feel. And, you know, sometimes a good psychotherapist might get you sort of talking or feeling things, but often it's just cognitive. It's just in your head. You talk it, you feel, think it, but you don't deal with it. And crying deals with it because it's the grief, the way you feel, and then it just forces you down that road. So I'm really thrilled that it did. And I know, you know, you were very distressed, and I was like, do I intervene? You know, I could sense that you were going through a difficult time, but I think, you know, I think people have to heal themselves. My role is to keep you safe. You heal yourself, and that's, I think, the journey you've been on too. So thank you, Nieke, for that. I just want to quickly raise to the viewers that are here, you know, if you have any questions, please put it in the chat or simply raise your hand if you feel, you know, you'd like to ask it verbally. So I think, Lorraine, you've asked for that. So please, you're welcome to ask any question to either myself or Nieke. Feel free.
Thank you very much, Prof. And Nieke, thank you for sharing. Yeah, it's really great that you are willing to share your journey. Prof, let me first ask Nieke just one
Sure,
question.
go ahead.
Nieke, if you don't mind, you've done mushrooms before, and you call them mushroom trips. How do you compare? What's the comparison, or what's the difference or similarities between mushrooms and this?
Okay. Let me just preface.
Then I'll ask the Prof the other questions. Yes.
Yeah.
No problem.
I think when I did the mushrooms in the past, they call them soma retreats. They administered too high an amount, which meant I did have an ego death, and I couldn't remember everything that happened during the trip, which made me feel very out of control. And I would hear afterwards from some of they call them watchers, that I would have made weird sounds or weird movements with my body. So it made me feel a little bit embarrassed. And so that kind of the administering of a mushroom compared to the Keta-Therapy felt very, what is the big words, the English word? It can't be controlled. And because every body type and person is different, um, there was a one amount that was administered for the whole group. I just think it was actually a little bit irresponsible. Though what they give to one, it would often also, depending once again on the strain of mushroom, but would give me experiences for processing that I needed. But I do find with the Keta, and I don't know if this is to do with me, that I've maybe matured a bit. I don't know, maybe know myself a bit better, but I feel like the Keta-Therapy gives me very clear feelings and images that I know what the work is, that I know what the message is behind it. The the mushrooms felt a bit more austere, and I almost couldn't place it. That was my experience. And as I said, I don't know if that is actually to do with the difference of a mushroom versus the Keta-Therapy, or maybe just, this is 10 years post that I've done Keta-Therapy compared to mushrooms. But that's my experience. I really feel like with the Keta-Therapy, I can identify very
The
clearly
issue, yeah.
what's going on, what are my processes,
Sure.
and also consciously. I don't like the idea of going places unconsciously anymore. I'd rather process what's going on in my life in a conscious way. Yeah.
Yeah.
Perhaps, Lorraine,
So,
I could just quickly respond to that as well. Karen, if you
yeah.
want to ask on the same issue, go ahead. But if before you come to me on the other question, I could respond to that. So go ahead, Lorraine. You were saying something.
No, I wanted to ask her, so after Keta-Therapy, are you able to go on with your daily lives, let's say the day after, or do you find that you need to be by yourself? Can you be functional as you are if you have to wake up to go to work? Are you able to do that?
Yes, I was able to.
Okay.
But again, I want to preface, sometimes what's brought up can be, like this last session I had with Prof this week was very intense. I grieved for 40 minutes straight. And I was so lucky the next day to have time open and have a session with my therapist, for example. But I was able to, because the eating afterwards and then sleeping and then going about my day was possible. But I think, and Prof, I don't know, you can fall in here, but I think
No,
sometimes
absolutely.
there are times when what's brought up can be very emotionally like a cathartic release. And you can't plan when those times will come. But yes, you can be functional. Could I have gone to work this week after that? Yes, I would have just been a lot more tender. And I would have had to be more intentional about how I approach my work. But it really depends on what's brought up in session. But you can be functional, but like, I'm just grateful this week I had space.
Yeah, yeah. And I think,
Right.
Lorraine, it is important when we meet, if we meet, it will be something I stress is, listen, you kind of very spaced out for anything up to 4 hours. Drug leaves you within that time. If you come to us mostly in the evenings, the next morning, you're pretty okay. Sometimes people feel a bit tired up to about midday or even the day sometimes. But what we do is we say, listen, we don't want you to do too many in a week because it's too much happening. You just unearth too much, and like we said, 10 years of psychotherapy, you don't just swallow all of that in a cinch and get on to the next journey. So you do need to digest things. And so I say, listen, preferably over 3 weeks to a week, and then please just keep some space. Don't fill your life, don't treat life like normal. This is a journey, it's an investment of yourself to improve yourself, to deal with issues. So just create some space, in your life. It doesn't mean you're
Okay.
flawed, but give yourself some opportunity. Don't clear your diary, so to say, a little bit, so that you can
Sure.
get. And especially, Nieke was fortunate in having a good psychotherapist. I do some of that integration work with, but what I encourage is that you can get value in having a psychotherapist. If you had a relationship, it can work fine, but you need to sit yourself, and we give a handbook, a workbook, and say, go through these questions, because you yourself can sit and reflect and find good breakthroughs suddenly coming through, because your brain is primed to, in fact, connect differently in the weeks after the infusions. So you can manage many, and it's what we encourage, that, listen, Keta-Therapy is not a fix-it. It's just a catalyst. You need to use that catalyst to then make these leaps and bounds by digging deeply in your psyche, seeing what pops up, dealing with the life choices that you're making and the context that you're dealing with. And people make some, important decisions. We often emphasize, please don't decide, but reflect on it. At least at the end of your 6 infusions, then you're clearer, then you can make these decisions. And I must be honest, I did also psychedelics. There's great value. The difficulty is that the evidence is not enough yet, but more than that is the reliable supply of it is the real problem. there is, Keta-Therapy is a drug used, it's very strongly controlled. You buy it, you know what you're getting. You're not taking chances. This is a global supplier that manufactures and knows precisely what we're getting. I know what I'm getting. I know what I'm giving. I know what I should adjust to adjust. So, and it is an IV, which means the result is quick. But it's also, if I stop it, the stop is quick. 5 minutes and you literally are getting out of it. So it's much more controllable. It's short, it's 40 minutes. Whereas if I give you, let's say, I had a patient once, a psychiatrist said, listen, can you give a patient another way? I said, if I give them one dose, bolus dose intramuscularly or subcutaneously, which is the way you can do it. I don't know what this person's going to go to, where they're going to go to. I can start at baseline where we do, but it just felt like I'm not in control. I can't stop it. If I see the patient feeling very distressed, I can't help them. I can't ease them into it. It's done. I can only hold their hand. Whereas in this, I can adjust. I can stop, slow it down. It's lots of control, which is really super. We do want people to get into the space where the sense of dissociation is strong. Yes, even in that space, you're not psychotic. I've never had a patient that's delusional in the Keta-Therapy, but yes, the world will bend. But if you scratch the surface of, touch your tummy like Nieke does, or scratch the couch, you'll say, okay, I'm sitting here with Prof Moosa. I don't interfere because I think that pulls you back. We don't want your conscious we want to switch it off. That kind of happens so that your unconscious is actually operating very strongly because you're literally swimming around in that unconscious, subconscious space. And so to talk to you is pulling you back. It's making you have to think. And that's what we don't want to happen. So it is in that space, but you are not without the faculty of thinking. You might slur a little bit. If you want to make some sentences, it might be a little difficult, but you can call out and say, is it okay? Am I finished? That kind of thing. So you're never asleep, and at
Right.
least you're there, you're just having this very weird experience. And most people say wonderful, and wild.
Okay. Prof, I've got two last questions.
Yes, go ahead.
And please feel free to answer what you can and what you can't. It's okay. So I've done mushroom therapy as well. Mushroom, I've done a trip, and my experience was very bad in a sense that, yeah, I think so, because I saw animals, people that were with me in the group. I had to vomit several times for me to be okay, to get back to my senses. I had a running tummy, and I was vomiting. But more than anything, it was a very scary experience because everybody sort of had,
Look
stuff
like
that
animals, like you said.
looked like animals. The grass was moving, the trees were moving, like if you watch The Secret, that type of thing. So the question that I have, given that experience, and I'm not sure the dosage, and they said 3, I can't remember, but nonetheless, given that has been my experience, the first question is, do you think I'm a candidate then for this one? That's number one. Number two is microdosing. I think there's something called microdosing with mushrooms. Is this similar to that? And in the same breath, how long are the effects, or how long does the effects of this therapy, Keta-Therapy, last for? Because with microdosing, it's almost like you take it every day. After the prescribed 8 or whatever intravenous, whatever that you administer, how long will the effects be, right? And then 2 last questions. Can you target a specific issue that you want to resolve, or anything comes up, or something, whatever that needs to come up will come up anyway? For an example, if I've got grief that maybe I didn't deal with, my subconscious will take me there. Or can I say, no, I don't want to deal with grief. I want to deal with my fear of public speaking, as an example. I want to find out why, and I want to overcome that. Can you target this intervention for that? Lastly, can it help with memory fog, or forgetfulness that comes with age? Thanks.
Yeah. Please tell me if I missed any of the questions, Lorraine, but let me go through that. I think that you asked, am I a candidate? I think that you actually had very much the same experience, it seems like I had. And I think this is the problem I have, is this dose management. There is not a way, they literally crush it, and strains differ, and then the way they give it may the dose probably, then the way they give it might release it differently, the way they've kept it till you swallow. There's too many variables in that to know precisely what happens, what you're getting. And that makes it very challenging for me personally to not know where you are in this thing. And it's literally like you jump off a cliff, and I'm just standing at the bottom with a big, cushion and hoping you land safely. And it's 6 hours, 4 to 6 hours, and that can be very frightening, very intimidating, and very unhappy for anybody. And I can see that it's been intimidating. And I had that same sort of, when I tried it again, I did it with trepidation. I think the other thing that I find very different is that with Keta-Therapy, we actually put on music and we put on mask, and it's to actually reduce the external stimuli, and we don't talk. So you are actually in your own space. So when you don't have these triggers of reality being so shifted that it distresses you. That's really what's key. And so you are, having this weird journey, but if you are okay, you find it very relaxing, just wonderful, like a nice movie sort of, but just a 3D, 4D kind of feel to it. But I think when you open your eyes, you naturally just want to close it, because things are just moving, and it might be at a lower dose that people enjoy the stimulation, with shrooms. I'm sure when you're coming off it, and your dose is lower, more recreational, that, yes, the light is very, colors are beautiful and that kind of thing. But at the hero dose, that is just not the story. It can become quite challenging when suddenly you see people becoming animals, and you just don't know where you are, and you are in that space for hours. So I think there's a different approach. I actually thought that if I do shrooms, hopefully getting a good, reliable supplier, and knowing that, listen, this is not legal yet, but that if I were to do it, I would do it similarly to the way I do Keta-Therapy, which is to get people isolated so that they don't get confused by the reality outside of them. And that, I think, would be much less distressing for many people. So, you are a candidate, because at the end of the day, I've got to meet and talk, and we'll see, what is your precise condition. I think the one thing that from the scientific point of view is a caution, is that any patient with a history of schizophrenia would be a caution. But I've had patients who are on borderline personality disorder, who have what would be called delusion, some delusion, very narrow delusions, and they found improvements with it. And I think you asked the question about memory fog. I mean, we've had patients who just said they're thinking and focus. So I was going to ask Nieke, while it affects your affect, your mood, it also affects your thinking. You become clearer, you become more focused, more alert. And that, I think, is really important. In fact, we don't fully understand the mechanism of action of Keta-Therapy, and it's thought to have not only an impact on the sort of neurotransmitters that are in the brain. It is in fact thought to have an immunomodulatory effect as well. So in fact, it is not only does it, in fact, in the neurotransmitter space, the current antidepressants work by pushing certain neurotransmitters up. Keta-Therapy doesn't do that. It does push it up, but it actually creates a repair process in the brain. That's a repair that's seemingly physical, but there's current thinking going on that it is not just, it is actually an immune boost of sorts, and lends itself to your brain literally being modulated or moderated in the way it's fighting itself. And this has been shown with very good results with long COVID. Long COVID, the action that creates long COVID, which is really that brain fog, happens to be your brain, your body overreacting to the COVID virus and then attacking itself and creating the long COVID symptoms. And ketamine, Keta-Therapy has actually been shown to help that. So I think just to tell you, there's a lot of value. It certainly can help you if you found shrooms being helpful. If you look past the challenge, then definitely this is a candidate. A memory frog certainly can help you. I think the question you asked about addressing your own issues, we try to encourage intentionality. I think in all of these psychedelics is, think about what you want to deal with, and when you're getting into it, think about it, try to carry it with it. But I also tell people, listen, don't get stressed, because you might think consciously that I want to deal with X, but your unconscious has another agenda. And so please just go with it. And many a time I just say, let go and just let yourself flow. Go with the flow, because your mind and body, your deep mind and body needs to tell you, reveal the challenges you are struggling, and go there, because that might be actually what you need, and not, what you think you need. Because our cognitive brain is just the cortex, and we think that that is ourselves, but we are 95% unconscious. And that's where the mental health problems sit, where it's not clear why we do and feel the way we are, and we battle to think why we can't get out of it. But it's deep stuff, and Keta-Therapy just digs in there. Psychedelics do the same. But I hope that has helped answer your question. And of course, I would not want to prescribe here, but I hope this has served as general value. But thank you, Lorraine, for your questions. It was really strongly appreciated. If there are any other questions, yes, go ahead, Nieke. You think
that's
yeah,
such
go
a
ahead,
great
go ahead.
question. And
Yes,
I
and
know
Nasima
that
wants to
feeling.
ask as well. Yes,
When
go
you're
ahead.
in a session and it's bringing up something,
Yeah,
and perhaps you don't really want to deal with it.
that's
But
right.
I've found I cannot escape what it's bringing up. And I also know that whatever is being brought up needs to be processed.
Yeah.
So, for example, I told Prof this last time, I haven't had time to think what I need to process. But I remember also saying a few days before to my mentor, I'm feeling quite scared and I'm really unsure about what's going on. And I remember saying that once again, just expressing my feeling. And then the Keta-Therapy took me there, right to the base. Was it comfortable? No. But do I feel like I can manage my life without that deep-seated fear? It was actually just holding me back. Yes, I feel like I can actually now go about moving on with the fear that isn't like stuck in my body and making me debilitated. So there have been times when I've come with the intention, very intentional, and sometimes it would unpack in the ketamine. But I think that is the gift of it, is that it brings what you need to move through, whether that's gratitude and joy, or whether that is, yes, pain.
Yeah.
That is the gift it gives. And you
Mm.
can't in it just go like, no, I'm gonna rather go to public speaking.
Wow.
Public speaking.
Mm, mm,
Yeah.
mm.
And in fact, some people, Lorraine, actually, the patients who don't like it come back. Often that's the key problem. They don't want to go to that painful memory, and they get unhappy with that it forces them down that line, which is unfortunate. But those are the few patients that I've had. So thank you, Lorraine. Any further questions, Lorraine? You're
It
good?
was the one on microdosing to say,
Yes,
is it?
yes, you
Yeah.
mentioned that, and then we'll go to Nasima as well. So in microdosing, yes, it is actually an option. I know that a few of my patients have actually said that microdosing with shrooms feels very good and complementary, and to me, I don't see that as problematic, and would encourage it. I mean, we have the notion that ketamine. Keta-Therapy is not a standalone and only thing. It's not fix up everything. So if you need, if you're on, let's say, an antidepressant, As long as it's not conflicting, we say, listen, let's leave it. You can see as you're going along, if you feel, listen, I don't feel, I feel good, but I'm struggling with the side effects, consider coming off it and see how you go. But if you don't, if you're feeling bad, we basically feel our way through it to get you to a place where you don't need either the antidepressant or the ketamine, and it is you living life on your own, without these things in it. So yes, definitely shrooms as a microdosing is a definite option, and there's much more controlled, I think, manufacture of those microdosing. I've had patients who've actually done it themselves, but they seem to feel it happy. But microdosing can be quite fine. So let's go to Nasima. Nasima, you want to unmute? It's go ahead. But I think you asked about substance use. Go ahead, Nasima, and you can
So I
share.
thought, my question is, can these infusions be useful for chemical dependency?
Absolutely. I mean, that was one of the things that really shocked me when I was dealing with it. I mean, in the literature, they kind of sort of the big things are mental health, particularly depression, anxiety, and there's just so much around that. And then there were a couple of studies around mental substance use. And when I looked at it, I said, okay, it seems like, maybe sort of just not, it's a few studies, very compelling, but just not a lot. And then chronic pain, again, fair amount, actually more than substance use. But when I started dealing with my patients, and I had some patients with substance use challenges, and I saw the results, I was gobsmacked. I said, my God, this is really powerful. And I looked carefully at the evidence, and it is literally amazing results. I mean, we have had the literature out there, and these are systematic reviews, not a lot of studies out there, but amazing stuff where they found 60% remission rates. I mean, 80% response, 60% remission rates for up to a year, where people come off it. Now, remember, that is a medical intervention. It's not everything. You've also got to have the support system, whether it's psychotherapy, the sort of contextual management of a patient who is getting vocational support, not that they're going back, they're making changes to their life, occupying their life themselves, not going back to friends and contexts that predispose them to getting back into the habit. So they have to get all these changes. So, but as a therapy, a medical therapy, there is little, right now in the world, there's only methadone that is available to manage, and a couple of other treatments for alcohol. But Keta-Therapy has value with cocaine, heroin, alcohol, benzodiazepines, weed, in fact, I then did a study, a short sort of trial in Soweto, and I want to do a bigger study on it, on Nyaope, which is mostly low-grade heroin or cocaine, and also crystal meth, which is a big problem in the townships. And the results were quite impressive. So I think it's really worth a try, but together with other ways, other elements of management. When I look at the government's attempt at supporting people with abuse at the moment to substance use, they are literally taking them away for 3 or 4 months into these rehab centers, and there even the drug dealers are sitting in those centers, but they come back into the same context with nothing shifted. But in those contexts, they just dried out. There's very little that you can give them. And I don't know why ketamine's not climbing up the ladder as an intervention, to give them. So because there's so little else. So I think, what we were looking at is to do this ketamine in Keta-Therapy, Keta infusions, 6 over 3 weeks, together with psychotherapy and family support, and then some sort of vocational support program in Soweto. And we think it worked like a charm with the few we did. And I think we will be trying it as a study, because there's not enough evidence out there. We need to show this, very trustworthy, reliable fashion. So please tell people who are struggling to consider this option. It really is very challenging to have a person with substance use. It devastates the entire family, like all of the mental health does. but this is really worth an option, Nasiba.
Thank you.
Good. Well, thank you all very much, and thank you, Nieke, for sharing your, your experience, your journey, and I'm really glad for the benefit it's provided you, and I hope that you will get well, better, and that if you need, we are here. And I know you're going off for a couple of months to Cape Town to do some of the part-time acting that you're doing. So good luck with that. And thank you to all our viewers. Really appreciate you having us. And I'm glad that it was of value. It will be, the recording will be available on YouTube, and we'll send out a notice for it. There is one more interview next week. And we've just done these 3 to see whether the format works, whether it's helpful or not. So your feedback is most welcome. So thank you once more, Nieke, and thank you to our viewers. Bye, Nieke. We'll chat again.
Thank you so much for being on my journey. Thank you.
Bye-bye now. Bye, everyone.